All right, so I think we'll get started here today. I am Sara Smith, the Director of Public Affairs at the Office of the Commissioner of Insurance. Thank you all for joining us for our quarterly OCI DHS Healthcare Coverage Partnership Forum. We are very excited today to have some introductory remarks from our wonderful Lieutenant Governor, Sara Rodriguez. And without any further ado, I'll hand it off to her and she can talk a little bit about the work she's doing around healthcare workforce challenges. Thank you, Lieutenant Governor, for joining us.
Yeah, thank you for having me. I am on the road, so I got a little office over here so I could talk to you guys today. And it's just a pleasure to join you today for this discussion. Just want to thank the agency representatives here today from the Office of Commissioner of Insurance, Department of Health Services for their work in putting this event together, and for everyone who has taken the time to be here today. Thank you for being here. For those of you who don't maybe know my professional background, I am a nurse and a public health professional, and I've spent decades working in healthcare, whether that's at the bedside, within public health agencies, in insurance, or in private industry. I feel like I've done the gamut all across the different healthcare systems. But really, as Lieutenant Governor, I got into this job to make sure that I could be talking about the things that were important to me, which is to ensure that the voices of our state's healthcare workforce were being heard and that their needs were being listened to by leaders within this state. So with Governor Evers and myself and all of our agency partners, I'm really proud to be a part of an administration that takes that responsibility seriously. As the governor said during his State of the State address a few weeks ago, our administration is leading by example. We are working on programs to break down barriers for people to get their start as a nurse, such as the nurse apprenticeship program that we've launched. And we've declared it the Year of the Worker, prioritizing efforts to support and stabilize some of our state's most hard-hit industries. And we are trying to hit the ground running here in 2024. And that includes most recently launching the Task Force on Healthcare Workforce, task force that I am proud to be able to chair. So as a nurse myself and as a public health professional, I am just really excited to be able to lead this task force and be able to make sure that we have the recommendations that the governor needs. I don't take that responsibility lightly or assume that the road ahead is going to be an easy one. We know there are big problems that we need to address. And we know that the current state of our healthcare workforce, it's troubling. And with the recent announcement of significant closures across the HSHS and Prevea health systems in Western Wisconsin, that's at the top of our minds. And we want to find ways to safeguard and ensure a strong future for this vital industry. And it's just even more timely learning about these closures. As a leader of this new task force, we will work to focus on ways we can not only bring more qualified, talented workers to our state, but also have the support, resources, and tools to make sure they are successful. Do the critical work that they do every day to make sure Wisconsinites are healthy. So we're going to take on a lot of information, a lot of data, and present recommendations to the governor for him to include in his next budget. But we could not do this work with partners like the agencies represented here today. In the wake of HSHS and Prevea announcement, OCI, DHS, and our Department of Workforce Development, they sprang into action to help the folks and families who were affected, whether it was to make sure that people continued to have high quality care in that region or helping workers find jobs. Their swift and comprehensive response has made a great deal of difference, and I'll let them talk about that a little bit more. But again, we know there's more work to be done. And the governor said it best himself. We've proven that we can do big things when we're willing to do them together, including building a healthier and stronger state. So thank you again to everyone here for being here today, and I will pass it back to Sara Smith to give an update on the important work happening at OCI. So thank you.
Thank you so much, Lieutenant Governor, for joining us and for your work on that important task force. And I will apologize. I am going to turn my video off. I'm getting a bunch of notifications that my internet connection is slow here. This is one of the benefits of working from home is I have a better internet connection in the office sometimes, since that may affect my screen sharing if my internet goes down. So We will get right into our agency updates then. So, like I said, I'm Sara Smith. I am the Director of Public Affairs at the Office of the Commissioner of Insurance. So I'm just going to give a quick update about some of the work that we have been doing around the HSHS and Prevea closures. And then I will be handing it off to Deb Standridge, the Deputy Secretary at Department of Health Services, to talk about what they've been doing. And we've been working very closely in concert with them. So our updates may sound similar, but we're coordinating efforts quite a bit. So since day one, access to healthcare has been a focus of our administration and the Office of the Commissioner of Insurance. We've been working collaboratively with partners across the state, thanks in large part to this partnership existing and with our agency partners to get more people enrolled in health insurance coverage. Sorry about that, everybody. Okay. All right, hopefully we are all back on. Deb, you're the only one I can see. Can you give a thumbs up that my screen is shared again and everything's up? All right, perfect. Again, sorry about those technical challenges from our building at Jeff 3. The internet can get a little rough. So, all right. So, as I was getting to, we are certainly seeing disruptions in healthcare access, particularly in the Chippewa Valley in Western Wisconsin. And OCI has taken a proactive approach to make sure that insurance companies respond and adjust appropriately to these challenges so their policyholders are protected. So we were not aware that this announcement was going to be made until the day the press release went out, as did many of our partners. So we've been trying to move as quickly as we can since that announcement was made. So shortly after that, we reached out to Western Wisconsin health insurers to request information regarding the impact that these closures might have on their in-network providers. Also ask about their use of telehealth and their plan for communicating the network impact with their policyholders. So some of the things that we asked for specifically were also about providing coverage options for alternative provider types, knowing that there are a couple of service areas such as OB, labor and delivery, mental and behavioral health services that are going to be particularly strained in the wake of these closures. So we also reminded insurers about the step therapy laws that they will need to be in compliance with, as well as continuity of care requirements should their provider remain in the area, but at an out-of-network facility. So some of those things that, we're happy to answer questions about if there are any specific issues that people are seeing, but those were some of the things that we first asked insurers about from the beginning. We got some data back from insurers in response to these requests, indicating that roughly 24,000 enrollees across 11 counties and 10 insurers currently have plans with in-network access to HSHS and Prevea. That includes the fully insured market, the individual, the small group, large group, and a couple of Medicare plans, all of those combined. So out of those 24,000 enrollees, roughly 2,000 are impacted with individual market plans across 4 insurers. That's on healthcare.gov. All of those impacted enrollees also have in-network access to other major health systems like Mayo, Marshfield, Oakleaf, Aspirus, and Gunderson, for example. So a lot of the data reported to by insurers indicates a minimal disruption to networks given these other access opportunities through other healthcare providers. So insurers have been really responsive in our requests for data. We always work well with our health plans and are glad to see how proactively many of them are addressing this if they are seeing in-network challenges. And we're going to continue to be in contact with them throughout the coming months and year, including as a part of our various activities along the market regulation continuum that we enforce on a regular basis. We recognize that the closures will have a significant impact on individuals and families in Western Wisconsin that have relied on these hospitals and clinics really for generations. And we stand by ready to assist any insureds that might face challenges accessing care in the wake of these closures. So we're going to continue to work collaboratively with DHS, with the governor's office, with federal partners, with other stakeholders, and also working with, you know, any stakeholders that are assisting with enrollment in the area that might encounter issues or hear from consumers that are having issues in the Chippewa Valley. And I'm just realizing that in my quick screen sharing, I missed actually being on the slide that had a couple bullet points on that, but the gist being what I just walked through, that we are taking a proactive approach. As you can see from the pictures, we've been in the Chippewa Valley to make sure that we are engaged in these in the community and getting a sense of what issues people are encountering. So that's the gist from OCI of where we are at the moment. So I'm going to hand it over now to Deputy Secretary Deb Standridge at DHS to share from their agency's perspective.
Thank you, Sarah, and thank you for the invitation to brief everyone today on exactly what is going on in the Western region. I appreciate the information that you provided, Sarah. Just for everybody's knowledge, HSHS did serve notice, and that they're pretty much 30% of the inpatient and outpatient provider in that area, with Mayo being number one in terms of the amount of inpatient outpatient services provided, and then Marshfield at third. What I will say is that St. Joseph in Chippewa Valley, Chippewa Falls, is scheduled to close in March, probably around mid-March. And then the 19 Prevea clinics and Sacred Heart Eau Claire will close on April 21st. I will say that, as Sarah mentioned, the areas of concern are OB, emergency department care, as well as mental health and substance abuse services, both inpatient and outpatient. I give a lot of credit and applause to the Eau Claire Chamber of Commerce, Menominee Chamber of Commerce, as well as the Chippewa Valley Chamber of Commerce. They have assembled an incredible task force of elected officials, both state and local chambers of commerce, public health, healthcare providers, et cetera, to really work on identifying the gaps in services that will be prevalent when the services at HSHS close down. And there has been a lot of movement in that area in terms of progress and taking a look at where capacity can be expanded, where new programs can be sort of parachuted out of a plane and established there to fill some of the gaps, especially in mental health and substance abuse disorders. Both Mayo and Marshfield are expanding capacity with OB programs. They are working with our Division of Quality Assurance in reviewing building plans, expansion plans, et cetera, knowing that they have the ability to do so. We're very grateful for that. But knowing that with Sacred Heart being a large provider of births, that the volume is still there and there needs to be provision of that. So congratulations and great applause to Mayo and Marshfield, who are looking at expanding their OBGYN divisions, as well as taking a look of how they can also assume more volume in emergency department care just as well. So we're very happy about that. I think it's important to know, I meet with HSHS every single week, as well as the other healthcare providers, and have a connection with the task force. And there's a lot going on. There's a lot of moving targets, but I would say the progress is positive in that area. Prevea, the physicians that are in the Prevea clinics in the Western region, in the Eau Claire area, in Chippewa Valley, not all physicians are leaving the market. I was really happy to hear that. Some physicians are transitioning from Prevea to independent practice, and some are looking at options within the Marshfield and the Mayo department, so our health systems. So it's good that they're looking at this, and some physicians are deciding to stay. That way they can keep their patient panels and their patients in terms of that primary care, and some specialty care won't be disrupted. Who those physicians are, how many, I don't have any idea at that point. It was just some of the information that HSHS gave to me last week, and they're still working out all the details of that. But I thought that was positive movement on their part. Also, I think a lot of praise has to go out to our workforce, our division of workforce development. There are 1,400 employees within the HSHS division. health system that are going to be displaced, and our Division of Workforce Development had an incredibly successful health fair on February 7th, and there's another health fair on February 20th. It was standing room only, and a lot of the employees that are being displaced were able to identify jobs and opportunities that they can pursue as their position within HS winds down. I will also say a lot of people are concerned about patient transition, care transition. Excuse me, as many of you are. HS is deploying a lot of their care management directors and their people to work one-on-one with patients, especially those most vulnerable and that have complex care plans, and work with them in terms of transitioning those care plans to another provider so that no one falls through the gaps. HS, as well as the other two providers, strongly believe in patient care, strongly believe in making sure that no one has disruption to their care, and are working hand in hand with each other regarding it. I think what's also important to know, as Sara was talking about, that Governor Evers and his administration under his leadership has done a lot for rural health care during his tenure as governor. We have invested a lot of money in terms of Medicaid reimbursement, that being $29.9 million for rural hospitals, much of that going to the Western region, $7.1 million in supplemental payments to the Western region. We have funded community health centers in that area during the budget times to the tune of $2.5 million. As well as providing expansion in terms of graduate medical education and providing residents with the opportunity to do their residency in the Western region. So a lot of money in terms of the government's budget, and Governor Evers' focus has been in rural healthcare. So again, us working in the Western region, it is nothing new to us because we have been so involved in rural healthcare through Governor Evers' tenure and under his leadership. So we're very happy about continuing that and continuing to invest in rural healthcare. When it comes to Medicaid, 1 in 5 Wisconsinites receive healthcare coverage through Medicaid. This is an area that we're working with our providers on, and with our the HMOs, in terms of making sure that those patients that receive Medicaid, which is a large percentage of the payer mix in the Western region, are also being able to transition patients from the HS Prevea system into other health systems without any gaps in coverage, without any gaps in terms of the continuity of care. So we're working very hard with that. And just in terms of our focus is very intense on the Western region, as it always has been in rural healthcare under Governor Evers' leadership. Sara?
Thank you so much, Deb. All right, so are there any questions that people may have, and knowing that more specific questions may need to be taken offline if there's a complaint or anything that one of our agencies would need to look into, but we could answer. I didn't see any questions come in while we were speaking. And I don't see any coming in now, so we will maybe keep going with the meeting today and move on to our next topic. But we would just, if you do encounter any issues, or if you're working with any individuals in the Western Wisconsin area and have any issues, feel free to reach out to us at OCI, in particular if you have any coverage questions or challenges that you are seeing. So all right, then we will move on to the next topic on our agenda, which is a recap on open enrollment from the Marketing and Promotions Work Group and Stephanie at Covering Wisconsin. I'll hand it to you, Stephanie.
Okay, thank you, Sara. My name is Stephanie Sievers, and I am the Insurance Literacy and Communications Manager at Covering Wisconsin and co-chair of the Marketing and Promotions Work Group. Okay, so I want to just start off with enrollment numbers for this open enrollment are phenomenal. It's our highest ever. We're all very pleased, I'm sure, of these results. And And we had a over 20% increase in people sign up through healthcare.gov from last year. And if you just look at this chart, I want to highlight, because when I think of this chart, I think of promotions and marketing, but there are other things that play into the success of open enrollment. But if you look at this chart, in 2016, there was a new administration in the White House that really pulled back on marketing and promotions, as well as the open enrollment length was shortened. But you can see that each year there was less and less money invested, and enrollments really, really plummeted. And then at the beginning of 2020, I mean, of course, we have, the pandemic hitting around that time. That's also when this group was formed and the promotions and marketing work group started to really come together and make an effort. Instead of all of us doing individual pieces in different markets of marketing and promotions, we're coming together and making a game strategy for how do we reach the entire state. And I like to think that one of the reasons that chart has just a wonderful J curve, really, really skyrocketing, is part of the promotions and marketing work group's efforts. So of course, it's also outreach and so many other pieces, but I think it plays a really strong piece. Okay, if we could go to the next slide. Okay, I want to highlight that. How did we get those numbers? Well, the partnerships, it's not one group doing one effort. It was government, partner, community organization coordination on messaging, promotions, and platforms, Wiscovered being one of those platforms. Also revved up outreach that happened through the regional enrollment networks, which I know Caroline's going to talk about after I'm done here. And then really just with this partnership coming together and establishing common goals and then working towards them. So I think all of that really played into those phenomenal numbers. Okay, so with the campaigns that were run with all the work group partners, and I put all our numbers together, we had total landing website visits of over 120,000. Now, that's not impressions of people who saw an ad. That is people who saw something and made a choice to click or go to a website to learn more. So we're pretty pleased with those numbers. We had over 1.4 thousand, or I should say 1,400 calls to 211, which a lot of the TV ads are telling people to call 211 or go to the website. There's also a lot of outreach cards out in the community that direct people to 211. Total digital media, so that's streaming TV, social media, and Google. The impressions were over 10 million. Total digital media clicks, which is a great number as well, is 100,000. So that's somebody who saw something and was engaged with the content and clicked to learn more. Total TV ads, we ran a pretty large cable TV ad this time, and that was over 39,000 ads were run in the markets across the state. And then we had a great year for earned media. We had over 38 articles that were published. Okay, so it all started with the open enrollment kickoff, and we were lucky enough to have both the Commissioner of Insurance and Tony Evers join us. The governor's presence really helps bring the media, and which helps really get the word out. So we were so pleased that was a part of our kickoff events, and that particular event was at Centro Hispano. Which led to, thank you for the next slide, led to a lot of articles and TV coverage about open enrollment. So you can see a lot of these are October 31st or November 1st or 2nd. Just really the dissemination through the media was fantastic for the start of open enrollment. And that's really when we want to get out a lot of our interest and coverage and really draw attention to sign up now, because we don't want people to wait to the last week. So that was fantastic. But we also got quite a bit of coverage through all of November and then December and a little bit even in January. So I'll say the 38 articles also did not include coverage in January. So, but there was a lot of articles then as well. So the specifics of the 211 helpline referrals, we had over a 66% increase in calls to 211 that were asking for information related to health insurance coverage. And here's the map of where those calls are coming from in the state. I already put that it was a 66% increase, but I wanted to show you the map of calls to 211 about health insurance from 2018, just to show you all the work that has gone into making people aware of 211, that they can call it for health insurance. There's been a lot of work to increase awareness across the state, specifically related to health insurance. So we're really pleased to see how many counties now have learned and people are calling. Okay, so a lot of the ads in the market are directing people to WIS Covered. So WIS Covered had over 50,000 page views. And of the people who went there, over 1,000 then clicked in to go to healthcare.gov. 700 visitors went to the Covering Wisconsin Enroll page, which allows them to make an appointment with a navigator. And the majority of the people who arrived to that website did so via paid ads on Google or social media. One of the aspects, widgets that's on that page, it's on also the other two major landing pages where we direct people, is the web chat tool. So the health insurance chat is during working hours from 9 a.m. to 4 p.m. People can directly chat with a live navigator. So that's a pretty phenomenal thing that we've been able to roll out during just before last open enrollment. And from last year, we had 101% increase of people who utilized this chat tool. Okay. I imagine Sarah's advancing slides and has a little bit of a delay with her slow internet connection. So the statewide cable and streaming TV campaign, that was a switch from the last few years. We've done a public education program through Wisconsin Broadcasters Association. And this year we decided to try something a little bit different. We wanted to reach more people in the rural regions, and we thought we could do so with cable. But we went ahead and put a lot of ads on cable TV, but through Spectrum, we can also pick up a lot of different streaming channels like Hulu and Sling and a variety of different platforms. And so ads were run on both of those, the cable TV and the streaming. The Google Ads campaign, so the three major partners of the work group put out their own campaigns. So Covering Wisconsin did the statewide, Milwaukee, MCAN did Milwaukee, and then Partnership Community Health Center did Fox Valley. So really just that allows us to really personalize the messaging for communities. And it really does help speak to the audiences in those communities. So for the statewide, we had over 2.5 million impressions and over 31,000 clicks. And then, and I put some of the examples of those ads here: need health insurance for a chronic condition or need help paying for healthcare. We're able to upload 15 different ads, and the computer algorithms will play those according to who they think might be on the computer and the success rate. So it's AI generated, it learns and gets better as the time goes on during those ad campaigns. Milwaukee ran the ad here that you see, health insurance, get it, use it, keep it. That was one of their major campaigns this year. And I just want to highlight Imani there. I'm going to talk a little bit more about her with social media. And she was also on buses, and her social media did really, really well. We went ahead and ran her statewide. So she was a very successful campaign. And she's an influencer and in the Milwaukee area. So for social media, there's various types of ads we run. So sometimes we might just create a commercial and then run it, or some type of GIF, video. We also work with influencers, and they create their own content and post it to their channels, and then we'll repackage it as an ad and place those. So different channels where content was run was TikTok, Facebook, and Instagram. With all three agencies, we had over 5 million impressions and almost 60,000 clicks just through social media campaigns. Milwaukee did a really bang up job this year on social media, and I think that we've got the data to show how successful that was. I want to, if you go on the next one, oh, and there's Imani there. I'm sorry. Imani did really well in Milwaukee and statewide. She was a pretty popular ad that we used, and hers got a lot of impressions and clicks. Okay, next. So I wanted to talk a little bit about the audience of social media, because this is a new area in the last few years of really just trying to put out ads and prioritize different audiences throughout the state. And we have noticed that the Facebook and Instagram audiences trend female. I know Milwaukee had a pretty even split this year, and there's a very high participation in Facebook in Madison and Milwaukee. But I wanted to take a look at the other two that you may be less familiar with. And one is TikTok. When we first started running ads on TikTok, it trended to be 75% female were our audience members, and very, very young. And if you look at this data now, it's really interesting. It's evolving over time. This year, 60% of the people who saw the ads were actually male. I think that's the nature of TikTok really evolving and changing with the audience demographics, as well as we're really trying hard to reach male audiences as well. And you'll notice that the age demographic for TikTok trends younger, but we've got quite a bit of participation in the ages of 25 to 34. Snapchat is one that we ran statewide, and our numbers, our overall numbers for Snapchat are never super high, but we always stick to Snapchat because it does well in some of the markets that are outside of Milwaukee and Madison. And also we tend to reach more men that are a little harder to reach in some of the other social media platforms. So as you can see, Snapchat is trending 73% male, and then we have here like what other things those male audience members like to look at in their social media channel. So we've got shoppers, gamers, sports, film and TV, and football. Okay. Next, we also recognizing that, you know, cable may not reach all rural audiences. It's a rather expensive thing to have. We also wanted to dig in and reach people at the community level via the newspapers, because they tend to be a real source of community. You know, people buy the newspapers so they can see their kids and they run articles about the sports teams, the local teams, and what's happening. And so we've had really good uptake from those local ads in the newspapers. So we ran 5 weeks of ads in 7 newspapers in the Northwoods region. That was like 7 different counties. And then we also ran a pilot this year of Walworth County in 8 different newspapers, and that circulated to 34,000 residents, all 8 newspapers. So. This year, we're aware of the city of Beloit and the Sauk City Public Health Department also using some of their own dollars to place ads out into the market. They were prioritizing open enrollment and health insurance access and coverage, and that was a great thing to see. We know, I wanted to mention city of Beloit specifically, they had some leftover grant dollars that they put in bus placards. Because they wanted to reach child care providers in the market, because there was a recent study talking about a real lack of knowledge and coverage for health insurance with that particular audience. And so I wanted to just say that when you've got the bus ads, the cable TV and the streaming TV, and also the social media out in the market, it can impact what we see for different performance metrics. So when I look at the Google ads, I've never seen Beloit score so high compared to other regions. You can see Beloit has a population in the 30,000 plus range, but you know, we had more Google ad performance be successful there than Green Bay or Kenosha or La Crosse counties. So we really felt like that bus placard placement did something, right? It you know, the more different touches from different media sources you can see of the same ad, the more it can boost recognition in the market, and then people might take action. So, and I'll just say that I believe Sauk City used content from OCI for their billboards, and the city of Beloit used content from Covering Wisconsin from the toolkits. So speaking of toolkits, so OCI, Covering Wisconsin, MCAN all every year produce toolkits. I know that also both MCAN and Covering Wisconsin for sure have updated toolkits for the Unwinding, because it's still happening. So it's not just open enrollment. And I encourage everyone here who's working out in the communities to spread the word about the toolkits, because this is a great way to get professionally designed ad quality outreach cards, social media posts, and then you can reuse them and personalize them to use in your own space. So we do work with the various RENs, and we work with different agencies to personalize and tailor content. Okay, and I want to just keep reminding everyone, the Unwinding is still happening. We've got quite a few months to go, and I know the numbers for the next few months are high. I have a lot of people who need to renew. So go to those toolkits. DHS also has a toolkit, and the link is here. And I know they've got some updated new content, and we've still got a lot of work to do with the Unwinding. So please help us spread the word. Thank you.
Thanks, Stephanie. A lot of exciting stuff in communications during this last open enrollment period, and I think it's paid off. So always exciting to be able to recap all of that work that you all do. All right, so now we are going to move on to the next part of the agenda, the Regional Enrollment Networks report. So I'm looking for there you are. I'm handing it to Caroline.
Thanks, Sarah. Yeah, and this is a nice continuation of the update that Stephanie just provided. We can go to the next slide. The Enrollment Network, and I would say Enrollment Network and Outreach Work Group of this partnership, we meet as a statewide group once a month. And then here you see the 9 people that then lead the 10 enrollment networks that make up this map to the right. And we provide a lot of partnership, information sharing, and key messaging to get across the state in order to meet the needs of our communities. So if we go to the next slide, the enrollment networks were meant as a collaboration between local and public-private sector stakeholders, including the state and county agencies, to improve health insurance outreach, education, and direct assistance with enrollment. And through the Unwinding, our goals have been to keep local partners informed, whether it's policy changes, little p and big P policy, and really just the process of making sure that people all are talking from the same book. Organizing our local outreach efforts so that it's not us in the community stepping on each other's toes, but rather figuring out how to strategically work together, because we're all trying to talk about the same thing, but we know that we reach different groups of people in different ways. Creating that culturally relevant and regionally relevant information and promotional materials, for example, the toolkits that Stephanie shared, and really utilizing the enrollment networks as a place to get feedback, to get consideration for different communities, and really leveraging the expertise that we hold within our own communities to share information widely. And then building up our enrollment assister network, along with having a place for the state and local to meet and communicate regularly, has been invaluable throughout this unwinding process. Next slide, please. And just so that folks have a snapshot of what our enrollment networks look like, essentially a year and a half down the line as we've restructured or recreated some of them. There are 10 in existence. 8 of them are regional and 2 of them are community focused, the Latina Enrollment Network and the Hmong Enrollment Network. We have about 2,335 members and growing, and we are continuously looking for more partners to join us at your local enrollment network. And these are all virtual meetings, so you don't have to be anywhere, but you can still participate and provide input and provide feedback and be a part of these conversations happening at a local level. So if you are interested, feel free to reach out to me after our meeting today. We have usually monthly, bi-monthly meetings. That has been through the duration of the unwinding. We anticipate that after the unwinding, we'll probably go to more bi-monthly and maybe even quarterly cadence. And we have about 400 members of the larger 2,000 or so that join a virtual meeting at least once a quarter. And some of the items that we talk about are open enrollment, Medicaid unwinding, obviously being a big priority this year, but then other things around eligibility, different changes to state and local programs, the connector tool and how people can access referrals and make referrals to local enrollment assisters, data, and then really anything that the region and or community think is important to connecting people to coverage and care. So that's where these can really change the formation of the enrollment network to be more catered to the immediate needs. So for example, and we'll talk a little more about that, the closures of the hospitals in the Northwest, this is something that has now been picked up with the enrollment network to talk about so that more partners are aware and can make those thoughtful referrals. And last quarter, we've had 23 enrollment network meetings facilitated among the 10 enrollment networks, including 3 trainings. Next slide, please. One of the priority topics over the last quarter was sharing of data. Because it's a natural venue to share information quickly among a lot of partners, we have used them as a place to specify and hone in on local data as well as the Department of Health Services and OCI and national data has become available. We have created these chart packs that are specific to each enrollment network that go over Medicaid overall enrollment, Medicaid renewal rates, uninsured demographics, and healthcare.gov enrollment trends. And through those packs, we're then able to compare where we are now, where we were before the pandemic, and what the trends are looking like. And with those trends, can maybe strategize our outreach and promotional efforts to communicate information to our community that will hopefully improve the outcomes of what we're seeing in the data thus far. So for example, we're seeing in kind of this past halfway mark that the statewide enrollment trends are kind of a loss of Medicaid coverage in the 12 to 15% range. But when we look at the Latina community, we're seeing a slightly higher percentage of loss of coverage, even though when we look at rate of continued coverage when enrollment is, or when a renewal is completed, and that means verification is submitted, a higher rate of people actually maintaining their coverage in the Latina community. So to me, that's a trend of if we can get folks in the Latina community to complete their renewal and submit verification, they're more likely to maintain their Medicaid coverage. And if they're not, then we can at least get them to the next type of coverage that is available to them. But that's one of those things that we'll be looking in this next half of how can we better communicate that across the state. And then one thing that is now available to you all is that these localized enrollment packs are now available on Covering Wisconsin's website at coveringwi.org/REN data. So would love for you to check out kind of what we have, and we will continuously update them as new data is made available. Next slide, please. And then another example, in my last slide for this section, is that enrollment networks can share information fast. We have these email lists, and then we have our regular meetings, and we also have partners that are now connected, so they talk to one another to better coordinate when things come up in our communities. And one example of that is just recently, and what has been talked about at the earlier front of the meeting, are these closures of the hospital systems and some businesses that are also closing right around the same time in the Northwest. And because of that built network, the rapid response teams have already reached out to the Northwest Enrollment Network lead, as well as navigators in that area. And we've already been able to expand and disseminate the information in real time as it's happening to the community. And so when you're talking about the sessions that they're having to get people connected to new jobs and new opportunities, it's this large network that's making this work. It's not the only thing, of course, but it is something where building relationships and maintaining them and keeping them strong has a lot of power when you need it. So it's one of those things that I think sometimes can get not considered, because it's like, well, when this moment hits, then we'll know to act. But relationships and trust take time. And so having that embedded in our system already really makes this work function at its peak performance. And so we don't have to wait for the next pandemic or the next emergency to really make sure that we can get all of our partners in one place at the same time. We already have the system built in, and it's unique to Wisconsin. I talk to our partners nationally, and they do not have a system like ours. So it's something to be proud of here in Wisconsin. And I think this is where I transition back to you, Sarah.
Yeah, thank you, Carolyn. Yeah, we are so lucky to have the wonderful regional enrollment networks that we have, and to be able to plug them in with this greater forum. So it's been a great network for us to be successful in Wisconsin. So now we are just on to the last kind of open agenda item is on questions and feedback. Although you are also always encouraged, if you have a question or a more specific situation that you're encountering that OCI could assist with, or Covering Wisconsin or DHS could assist with, to reach out to us directly. But we are happy to answer questions that you may have right now, if there are any. You can put it in the chat if you would like, or I'm not seeing anything come into the chat. I'll give it another minute here, but if there are no questions from the group, we could wrap up a little early today, and we really appreciate all of your time and participation in these forum meetings. We always hope there can be greater engagement and connections between all of our different groups and all the different stakeholders, and hopefully this is a good forum for that. So it looks like I'm not getting any questions in. Again, I apologize for my technical difficulties in today's meeting. Thank you for everyone's patience. And we will see you at the next forum meeting. And once we set that date, we'll set out a meeting invite to everyone as usual. So, all right. Thank you again, everybody.